Due Process, recipient of 6 Mid-Atlantic Emmy Awards.
Tort reform now! Tort reform now!
Doctors walking out, protesting, picketing, demanding a cap on awards for pain and suffering. Awards they say are pushing their malpractice rates up and driving some specialties out of New Jersey. Are they right? Will they win? The medical malpractice crisis on this edition of Due Process.
Major funding for Due Process is made possible by the New Jersey State Bar Foundation, committed to educating the public about the law. Additional funding is provided by Lawyer's Diary and Manual.
There have been other doctor walkouts on a smaller scale, but nothing like what we've seen here in New Jersey. The most massive mobilization of physicians this country's ever seen, and the threat that there could be more. I'm Raymond Brown, and it all comes down to 2 loaded words: medical malpractice, and what to do about those soaring premiums doctors are forced to pay for insurance. We'll get 3 very different prescriptions from a doctor who's also a member of the Assembly, from the man who literally wrote the book on medical malpractice law in New Jersey, and from the state senator who says he's determined to come up with a compromise. But first, here's Sandy King.
Raymond, there are 3 big questions behind this story. How do we get into this mess? Who's really to blame? And is there any good way to fix it? Malpractice insurance is costing more, much more in some cases, twice what it was just last year. But is that the fault of greedy lawyers, runaway juries, and outrageous awards, as the doctors claim? Or is the greed on the part of the insurance companies and the fault with a few grossly negligent doctors who account for a high proportion of the cases? And how do we deal with the notion of doctors on strike?
Tort reform now! Tort reform now!
It was day 1 of an unprecedented statewide walkout that took doctors out of their offices into the street and brought patients to emergency rooms in record numbers.
It has been probably double what we normally see, with a lot more acuity or sicker patients. The good news is we were more or less prepared.
Tort reform now! Tort reform now!
More than half the state's doctors were said to be on strike, canceling office hours and elective surgeries.
The office will reopen Thursday, February 6th. Are you having a problem?
Answering only emergency calls in the most massive MD walkout in any state ever.
We have to pass a constitutional amendment to send to the court to do that.
But unlike the job action, the crisis in medical malpractice insurance is not unique to New Jersey, as you'd know from the State of the Union address.
Many parts of America are losing fine doctors. No one has ever been healed by a frivolous lawsuit. I urge the Congress to pass medical liability reform.
But with the pressure turned up in Trenton, there's more likely to be action from the State House than the White House, at least in the short term.
We believe that the doctors are holding patients and patient care hostage, only to put pressure on the governor and the legislature to adopt a policy that fundamentally undermines patients' rights.
We're embarrassed, we're torn that we need to be here. We're not trying to point the finger, we just need a solution.
And Dr. Stephen Reish, a spine surgeon whose malpractice premium climbed 70% since last year, thinks he and his colleagues know what the solution is.
And if there's no legislation, it's not going to happen.
At least that's how the doctors see it.
What we need to do is stop frivolous lawsuits, and we also need to avoid huge excessive awards for trivial reasons.
Give me the list. Put up or shut up. Where is the list of those cases you say are excessive? Let's pull them out. Let's look at them.
You say they don't exist?
They haven't produced the list, and they don't exist.
That's the lawyer response to attacks like this.
The legislature has been blinded by the money for the trial lawyers. It is our job now to remove those scales from their eyes.
It's us they go after because we're the only ones there saying you did something to their victims, and you're going to be held accountable. The whole issue here is responsibility and accountability.
The doctors say what's needed is a cap on damages for pain and suffering. They've been pushing for a $250,000 limit. The lawyers say no.
We think they've misdiagnosed the problem and prescribed the wrong solution to try to cure the problem. We don't believe that patients who are injured as a result of medical malpractice should be required to pay for the bad business decisions of the medical malpractice carriers.
Last year, as an example, we had an underwriting loss of $30 million, and we look to report in excess of a $60 million loss in calendar year 2002.
It's no surprise that the insurers and the hospitals like the caps.
Tort reform, which is reducing the statute of limitations, putting a cap on pain and suffering, those are the kinds of decisions that need to be made by the legislators.
And yet there's no guarantee that if the doctor's liability for pain and suffering is pushed down by legislation, their premiums for malpractice will drop significantly too. So you say no caps?
We say no caps. Caps are just the wrong answer to this problem. They won't work.
Tort reform now! Tort reform now!
But despite the radically different views of how to cure the malpractice mess, there is in fact a crisis, especially when the work is high risk.
I trained as an orthopedic surgeon in orthopedic and neurosurgical diseases of the spine, and that is my entire practice. What exact portion of my practice is low risk? There really isn't. I don't have a low risk.
For New Jersey neurosurgeons, the risk and the premiums may be even greater. Their numbers dropping every year.
There has been a neurosurgeon who's left and has actually gone to Kansas because in Kansas they have tort reform and they also have money that they help pay some of the high-risk professionals with their malpractice premiums.
But the crisis may hit closest to home when it comes to delivering babies.
We decided we wanted to consider having another baby till Dr. Pavlev told us that he couldn't deliver babies anymore because of insurance costs.
About 30% of the state's obstetricians are not going to be delivering babies.
You know, we're not making a whole lot of money in this area. Reimbursements are extremely low, and I think that if the rates continue to rise the way they are, that myself as well as most of my colleagues will have to stop practicing obstetrics because we just can't afford it.
But would a cap on pain and suffering on so-called non-economic damages be the cure that the obstetricians and the other doctors promise? And would it be fair to those patients who suffer serious harm at the hands of their physicians? Well, as we saw, the trial lawyers and patient advocates are saying it would not. Yet a Star Ledger Eagleton poll conducted just after the walkout found that most New Jerseyans support some kind of cap. And what may be a surprising 2/3 say they support the doctor's walkout. And Raymond, it should be interesting to see how those numbers impact the search for a legislative solution here in Trenton.
Sandy, we'll put that question to two key legislators, a Burlington County Assemblyman and Dr. Herb Conaway, and the co-chair of the Senate Health Committee, Joseph Vitale. And we'll get the lawyer's take from Abbott Brown, whose practice is medical malpractice law.
I think that they are paying too much in insurance premiums. I think the reality is that most doctors are not hurting that much financially, however.
I have a daughter that's an obstetrician, and she wouldn't go into private practice just because of the amount of the insurance. I think that they're all hurting.
The doctors are there to be available to the patients whenever they need them. At the same time, if they are struggling, you know, they must do whatever they must do to protect themselves.
If they hurt somebody's pinky toe or fingernail, they got a chance of being sued for it. It's not right.
Certainly patients should have some rights, but there should be a limit to that. Yeah, something that would be fair both to physicians and patients.
But what is fair? We'll put that question to three men at the heart of the medical malpractice uproar. Assemblyman, physician, and law school graduate Dr. Herb Conaway, who supports the $250,000 cap and who closed his own practice for 3 days as part of the doctor's walkout. Attorney Abbott Brown, former chair of the Medical Malpractice Committee of the New Jersey State Bar Association. He's the author of the definitive New Jersey text on medical malpractice law. And with us from Newark, Senator Joseph Vitale, who finds himself on the hot seat as co-chair of the Senate Health Committee. Welcome to all of you. Assemblyman Dr. Conaway, let me start with you. I think one fact that everybody agrees on is that premiums have risen and that it is an issue of concern. Sure. In the report that we showed our viewers, there is someone who represents ATLA who is saying, where's the list of the outrageous or unreasonable awards that says the cause of this are the awards juries are given and the cap is the answer? So I think this is a fair time to say, what's the list? What are the cases or the examples that have caused doctors to walk out and to take the position they have?
Well, getting this data has been very difficult. Insurance companies, a lot of this information is shrouded in the contracts that go on with settlements and other things. And so as I've asked a number of lawyers how to get this data, it's not easy to obtain. We have accepted the testimony of people who run the major insurance companies here in New Jersey. They have told us that they are seeing a large number of these awards. In your own program here, Princeton Insurance, who has actually been backing away from covering physicians, has lost, what, $30 million or $60 million over the last 2 years. Those numbers are very telling. And so what I'm saying is certainly we do need the facts, but let's think about how we work toward a solution that will keep doctors in practice and protect access to important care by patients all over the state of New Jersey.
Dr. Conaway says that physicians are motivated by what they're told by the insurance company in terms of the awards impacting their premiums. Obviously, there are other economic factors that could be relevant, but is it the awards that are driving premiums?
No. There are no jackpot jury awards. There are few, if any, frivolous lawsuits. The data is not hard to get. The Administrative Office of the Courts came out with a report about a week ago which shows the number of malpractice cases are down over 30% from 1995 when the affidavit of merit statute came in. That's important because now when you file a lawsuit, you must have a doctor from the same specialty swear under oath that there's malpractice. Not only are the awards down, we've challenged the doctors. The medical society, insurance companies show us one case of a jackpot jury award where the verdict has not been reduced by the judge. It doesn't happen.
Let me ask you a question because I want to be sure that I understand you. Are you saying that whatever economic problems the insurance companies are experiencing are part of another economic picture and are not being driven by awards, which is the key factor motivating the doctors?
Absolutely. The data shows, and this is the definitive data from the National Practitioner Data Bank, over the last 10 years, 10 years ago, they paid $239 million in payouts. Last year, $254 million. The suits are down 30%. Perhaps verdicts, which follow the cost of medical bills, may be up. But overall, that trend is very flat. There are no jackpot jury awards. There are no frivolous lawsuits. There are only 1,600 cases for 8.5 million people. It has nothing to do with the tort system. Nothing has changed in the tort system in 2002 that wasn't there in 2000 when Princeton said we made $30 million and had 3 spectacular years in a row. That's from their...
Okay, before I go to the senator and ask him to give us the solution, let me ask you, Doc, because it does seem as though factually there's a big difference here between Abbott's position, which is really the premiums aren't being driven by awards, and your contrary view. I mean, is it clear that we have a difference of opinion based on facts?
Well, there are a lot of things that drive premiums, but and these awards are part of the problem. We think the biggest part, the mismanagement by insurance companies, also plays a role. The downturn in the economy also plays a role. But I think he makes our point.
Well, why
we have less cases, and yet the awards, by his own admission, are still going up. So what does it tell you about?
Here's the question I want to ask you. If the solution is not, if the cause, as Abbott says, is not large awards, then how does the cap solve the problem that you have brought to the table, you and other physicians?
Well, we do believe, from what we have been told by insurance company executives, that the large awards are in fact a problem, and it also works its way in what happens in the area of settlements. Because of the fear of going into court and facing a large award, a lot of physicians are settling for the limits of their policy, and so you're seeing a lot of these settlements that are climbing up to $1 million typically now. And so that is sort of underground here, but it's also a big part of what's happening with the rising cost of insurance to physicians. People are settling for a lot more than they ever did.
Let me go to the man who's undoubtedly going to put all our questions to rest. Senator Vitale, I'm confused. What is the factual cause of the rise in premiums, and is there legislation that's going to solve this problem?
Well, there are many reasons, and both Abbott and Assemblyman Conaway have articulated those reasons. As the co-chair of the Health Committee, along with my colleagues in the Commerce Committee, we've crafted what can be considered a compromise or consensus bill that will address the tort system from top to bottom. You just can't say that it's about just one thing. Although I will say that I don't believe that a cap at $250,000 or $300,000 will do anything to lower the premiums for physicians. And we're on their side, but we want to find an honest solution. And so we've looked at the system in terms of why is it that physicians' premiums have risen so dramatically.
Can you tell us what's at the heart of your plan?
Well, what's at the heart of our plan is that there are three things. One is medical errors reporting and self-critical analysis, something that the New Jersey Hospital Association has asked for, something that Commissioner Dr. Lacey has asked for, so we can learn from our mistakes and drive down the amount of medical errors and malpractice. The other is to allow those physicians and other healthcare professionals who are named in a suit up front to get out of those suits early, so that we can focus in on potentially that those one or two physicians or others who may be at the heart of that potential malpractice, save all of that administrative cost, which drives the cost of premiums as well.
Is there a cap that's part of this plan?
Well, part of it, one of the proposals at least, will say that there will be a limited liability for the insurer at $300,000, and then a separate fund that would compensate victims beyond that, up to $1 million or more, depending upon the system or the process.
And is that the proposal that's likely to ripen into law, one that has a cap like the one you just described?
I think it's 50-50 at this point. It's going to probably be released from the Senate sometime this month, and then go to the full Senate and go over to the Assembly for their consideration. They're partners in this process. They have a different tact in terms of what we ought to do as far as the fund is concerned. They would rather see a subsidy for physicians for 3 to 5 years until this marketplace corrects itself. I think that's a good idea as well, and we'll hammer something out eventually.
Assemblyman Dr. Conaway, is that a compromise, and is it a fair compromise?
Well, it is a compromise. I mean, limiting the liability of insurance companies to $300,000 will help reduce costs to physicians. A lot of physicians who I've spoken to, however, are concerned about the overall cost of the system. That is, we're not doing anything to wring some of this unnecessary money out of the system. And what we always say is, we are patient advocates. We're looking to make sure that everybody has access to care. And so there is a balance between individual rights on the one hand and the rights of the whole. And I think your last man on the street said it well. How do we create a balance so that we protect individual rights on the one hand, and yet make sure that your neighbor can go to an obstetrician and have her baby delivered, or if you're in an accident, there's someone there to take care of you.
Let me pick on something you said which dovetails with the polls. The Eagleton poll showed 2/3 of New Jersey residents who were polled supporting the doctor's position, and you described doctors as patient advocates.
That's exactly right.
Abbott, I think it's fair to say that many people say the voice of the trial lawyer, especially the medical malpractice trial lawyer, is tainted by the fact that it's an economic question for you. That is, you and your colleagues are obviously going to have your incomes affected by what happens. How do you get into a public policy debate and not have your point of view dismissed or discounted because of that?
Because look at all of the consumer groups who are against caps. ARP is against caps.
What is ARP?
Association of Retired Persons.
That's a long way off for me.
Right, okay. Look at the Star Ledger. The Star Ledger has had 3 editorials recently, all against caps. One of the editorials, they accused the Medical Society of essentially being disingenuous about it. The New York Times has editorialized against caps. The Bergen Record has. The Asbury Park Press has.
Is there a common ground that they take in terms of their opposition to caps?
Yes, they all understand the concept that a $250,000 cap, even according to the Medical Society poll, may reduce premiums 4 or 5%. So if you're paying $50,000, maybe you'll bring it down to $46,000. The way to reduce the amount of premiums is to reduce the amount of malpractice. The key fact here that we're not focusing on is that 5% of the doctors commit almost 2/3 of the malpractice. The defense attorneys call them the frequent flyers or the repeat offenders. If we were to better manage by education, by proctoring, by elimination, those 5%, we could bring that $50,000 premium down to
Let me ask Dr.
20,000.
Conaway, you're a doctor in the Assembly. Is it true that a small number of physicians are frequent participants in the system and that there is a requirement to discipline them?
That's what they say, and I'm all for making sure that we weed out bad doctors. But one of the things—
Would you insist that any legislation, or at least try to make an effort to see that any legislation includes some requirement of greater discipline?
Oh, yes. I mean, we might have to do it in a separate package. If it gets into this bill, who knows what will happen. We're having a tough time getting the current proposals through both houses of the legislature. But certainly that's something we need to look at. We need to look at making sure that we improve the system, decrease errors going forward. That's our responsibility. One of the reasons we can't do that very well is because when people step forward to say something happened, they risk losing their livelihood.
Well, that's what happens. Let me just jump in here in terms of medical errors reporting, and that was what's important about the proposal that's in front of us now, is that it will require hospitals and other healthcare providers to report those very medical errors and provide some level of protection for them. So a lot of the information won't be subject to discovery. It's the malpractice that, of course, would always have to be reported to the patient or their family. So those are, I think, cornerstones of many proposals.
Senator, let me ask you a question about what looks like it might be a gap. Clearly, in the process of making legislation where the issue is what's driving premiums, it would be helpful to look at the books of insurance companies.
Insurance companies have not been forthcoming.
Yes. Okay.
We've asked them time and again. They want us to give them a confidentiality agreement, and they've not been honest. And I believe that at the heart of this, the insurance company is at most of the fault here. You know, their business practices, their profits have dropped by tens of millions of dollars over the past couple of years, just like everyone else's 401k.
Well,
they're trying to make up the difference on the back of
Then let me ask a
premium
lawmaking question. How, when you have vigorous assertions of different positions by people who are pretty knowledgeable, lawyers, doctors, citizen groups, who are all exercising their constitutional right to speak loudly and eloquently, and you have a set of documents that it would be nice to look at as in terms of making judgments, how can you make good law without that access?
Well, I think we have enough information now that clearly illustrates really who's at fault here and what part of the problem is and what's driving this. And we know for a fact that this is the third malpractice crisis in as many decades, and each and every time it's happened at the time that there's been a significant downturn in the economy. Insurance companies have lost hundreds of millions of dollars and are looking to make up for that on the backs of physicians through their premium. We don't think that's right. We understand physicians are suffering, and so we're trying to craft something that makes sense. You know, there's the old saying that there are two things you never to watch being made. One is sausage and the other is legislation. And I can tell you, I think I'd rather watch sausage being made, but we're getting there.
Well, we're asking you to show us the details. Abbott, I didn't ask you whether or not you regarded the senator's proposed bill as a compromise, and if so, was it a fair one?
It is a compromise. I can't really say that I reviewed all of it. I know one provision of the bill is extremely disturbing. We saw the incident at Duke University where they made a mistake, and what Duke did is they came out and said, this is the surgeon who made the mistake.
The incident you're talking about is the little girl with transplants of the incorrect organs.
Right. Okay. And you had the same kind of mistake in Minnesota where they had the bilateral amputation of a woman's breast because of a clerical error. As I see it, this bill would mandate that that be reported to the state, but not mandate that be reported to the family. What Duke University did was almost unique and very important if we're going to fix this system. If a mistake is made, the family, if it's an adverse preventable error of serious consequence.
What do you say to people who are concerned about those two very dramatic
and let me just
cases?
say that the Medical Society insists that that be confidential, and confidentiality is what's driving a big portion of the problem. The public can't find out who are the bad doctors. I have a case with a doctor who's got...
But let me give Dr. a chance, because it seems to me this is an important part of the discussion.
This is an absolutely critical issue. Sure. And I ask anybody to put themselves in the position of the doctor. Something happens. You recognize it might be a systems error. You know, you didn't color code gases right, or a clerical error in this case. You understand that something may have happened, and so now there's a question. I can come forward and perhaps lose my license, or the hospital can close, or all of these other things, or I can be silent. And that's what happens. With confidentiality, people come forward, let folks know what happens, and we fix the system and prevent things from happening to somebody else. That's
Senator Vitale, as we close, one of the things these newspapers we've been talking about have said is we shouldn't rush into something just because there's pressure if we're not ready to make good law. Do you think that this process is being driven in a way that's not going to lead to refined and effective long-term legislation?
Well, I think we can't address every issue in this bill, but we're trying to do our best. I've been at this now for nearly a year, so we're not really rushing to judgment. What's frustrating at some level is there are times we don't have all the information from the insurers, but we have enough information from the AOC, and we know basically what the facts are, and we're trying to thoughtfully go through this. We spent literally months and hours every day working on this
A
issue.
last prediction, Senator, this bill is going to pass?
It'll pass in the end when it comes back from the Assembly. It may look like something
Assemblyman,
different.
will this pass?
We'll see.
And Abbott, will there be litigation if it passes?
I think if caps were passed, I think that's unconstitutional, and there would be litigation over that.
I have a feeling we'll be revisiting this issue because that's it for this edition of Due Process. But we'll be back here next week with another in-depth look at the legal issues that matter to us and matter to you. Until then, for Sandy King and all of us here at Due Process, I'm Raymond Brown. Thanks for watching.
To improve our healthcare system, we must address one of the prime causes of higher cost: the constant threat that physicians and hospitals will be unfairly sued. Because of excessive litigation, everybody pays more for health care, and many parts of America are losing fine doctors. No one has ever been healed by a frivolous lawsuit. I urge the Congress to pass medical liability reform.
Major funding for Due Process was made possible by the New Jersey State Bar Foundation, committed to educating the public about the law. Additional funding was provided by Lawyer's Diary and Manual,